The urinary system. Now, function of urinary system: maintain a stable internal environment, remove waste products, adjust water and electrolyte levels, and maintain correct pH of the blood. Urinary system consists of 2 kidneys, 2 ureters, 1 urinary bladder, and 1 urethra. Now we talk about urinary system. The kidney filter blood and produce urine, and the ureter transport urine to the bladder, and the urinary bladder store the urine, and then the male or female urethra transport to the exterior. Urinary system combining forms like azote or azoto, bacterio, cysto, glomero, glyco, and ketone. We know that azote, like nitrogenous waste, like BUN, and bacteria from bacterio, and bladder from cysto, glomerulus from glomerulo, and sugar or glucose from glyco, and ketones from ketone. So the urinary system combining forms like litho or litho, as stone, and meato, the meatus, nephro, like kidney, and night, nocturia, example, and oliguria, scanty or few of the urine, bilo, from the renal pelvis. Urinary system combining forms also reno, like kidney, and uro, from urine, and also we call the specialty like urologist or urology, from the science of urology, and urethro from ureter, and urethro from urethra, and urine from urine, like urinary system, and vesico from bladder, like we called it like in vesicostomy, the anastomosis between the bladder and the abdomen skin. Urinary system suffix like litho or lithiasis, ptosis, trypsy, urea, lead from a stone like renal lithiasis, condition of stone, and a ptosis, dropping of stone, trypsy, surgical crushing or lithotripsy, like this apparatus in the photo, ESWL, extracurricular shockwave lithotripsy. Urea, condition of the urine, like hematuria or biuria, like blood in the urine called hematuria, or the pus in the urine, biuria. Anatomy and physiology of the urinary system, also called genitourinary system. We added in the male the testicle and the penis and the vas deferens and the prostate to the urinary system in the male, called genitourinary system. consists of, like we said before, 2 kidneys, 2 ureters, 1 urinary bladder, and 1 urethra. Like in the photo, urinary system consists of 2 kidneys, 2 ureters, bladder, and the urethra. Function of the kidney. Main function is to filter and remove waste product from blood. And the metabolic processes produce waste. Blood becomes toxic if waste build up. And waste materials are called urine. So we see in the photo the blood with the waste product enter the kidney, and the waste product secretion to the ureter, and clean blood go again to the vascular system. Urine is then removed from the body through the collecting system and the urinary system. Hemostasis, the stability of the vascular apparatus, and like the balance between the constricture of the vessels and vasodilator product to produce the urine or decrease excretion of the urine. Responsible for hemostasis, regulate the level of electrolytes, and maintain pH. So maintain a proper balance of water and chemical in body, and regulate level of electrolytes. The main electrolytes, sodium and potassium chloride bicarbonate. Waste removal by the kidney. Waste is removed through the system of the blood vessels and tubules called the nephron. It's the small unit consists the kidney. More than 1 million make up each kidney, produce urine. Urine drain from the kidney through the ureter to the bladder to urethra, and then out of the body. Kidneys are located behind the peritoneum and concave area of on edge of the center called ileum. Located behind peritoneum called the retroperitoneal areas. All the urinary system located retroperitoneal, and many surgical operation through the approach retroperitoneal. The ileum consists of renal arteries enter to the kidney, and the renal vein leaves the kidney, and ureter leaves also the kidney. Kidney structure. Longitudinal section show the renal artery enter the ileum, and renal vein and the ureter existing at the ileum of the kidney, like in the photo. Internal structure of the kidney. Cortex, outer portion of the kidney, and we measure the thickness of this cortex. It's the main function of the kidney. And medulla, the inner portion, and pyramids, triangle shaped structure in the medulla, and papilla, tip of the each renal pyramids. This is the illustrating the internal structure of the kidney, cortex, and medulla, and the pyramids, and calyx, and renal pelvis, then the ureter. internal structure of the kidney, calyx, renal pelvis. The calyx is a small open area that receives the urine from each papilla. And renal pelvis, large open area that receives the urine from each calyx, empty into the ureter. Nephron, as we mentioned before, the small unit consists of the kidney, functional unit of the kidney, microscopic, and more than 1 million nephron in each kidney. And we now do the nephron sparing surgery to save each nephron to prevent end-staging renal failure. So it's a more advanced surgery now to save the kidney and prevent the renal failure. Consists of renal corpus and renal tubules. Renal corpus called two parts: blood flow through the glomerulus and substance filter from blood and interglomerular capsule. Two parts: glomerulus as the main consist of the filtration, and glomerular capsule or Bowman capsule, which the waste and water enter the excretion system. This is the kidney animation. There are 4 sections for the renal tubules: proximal convoluted tubule and lobe of Henle, distal convoluted tubule, and collecting tubules. Filtrate flow through renal tubules to complete urine production process. So after filtration, main filtration in Bowman capsule to the convoluted proximal convoluted tubule, then to lobe of Henle, then distal convoluted tubule, then the collecting tubules collect the urine, the end stage of consisting of urine. The structure of the nephron, as mentioned before, glomerular corpus and Bowman capsule, afferent arteriole and efferent arterioles, then the convoluted proximal convoluted tubules, then the Henle descending and ascending lobe of Henle, and then the distal convoluted tubule, then the collecting tubules. Here we mention that the arteries of the kidney, it's end branching system. There are no connecting between the arteries. So if any arteries damaged, there are damage in the function of this part of the kidney. Here the kidney labeling exercise, distal convoluted tubules. Here the stage of urine production. There are filtration and then reabsorption and secretion. Three parts of or stage of urine production: excretion and filtration and reabsorption. Urine is produced as a filtrate move through the renal tubules. 3 stages: filtration through the Bowman capsule and reabsorption in the proximal convoluted tubules, and secretion in the Hanley loops or in the distal convoluted tubules. Here the nephron capillaries and the Bowman capsule and the glomerulus filtration. Sorry, there are some noising around. Filtration through the glomerule to the Bowman capsule and then to the convoluted and Hanley loops and distal convoluted, then to the collecting system of the urine. Between glomerulus and the Bowman capsule, the filtration is produced by water, glucose, amino acids, and wastes. Filtrate intrarenal tubules. Reabsorption. As filtrate move through renal tubules, water dissolvable molecules are reabsorbed, returned to the blood in peritubular capillaries, and waste and undesirable molecules remain in the renal tubules. So after 150 mL excretion or filtration through the Bowman capsule, only 5 milliliter go through the urine excretion. As filtrate moves through renal tubules, additional waste products removed from blood in peritubular capillaries added to filtrate in renal tubules. Here the 3 stages of urine production: filtration, then reabsorption and secretion. And the same the nephron unit. Here the ureters urine drain from renal pelvis into the ureters, extended from renal pelvis to the urinary bladder, lined with mucous membrane, and longitudinal and circular muscles. So in the photo we see the ureter in the 2 sides. The ureter extended from the kidney to the urinary bladder, and here the urinary bladder sections through the trigone and the prostate and the urethra in the deep pelvis. We see the trigone, which mean the space between the 2 ureters and the bladder neck, the trigone of the bladder. Elastic muscle sac, the urinary bladder, elastic muscle sac, which store the urine and then empty it like order from the nervous system. Lies the base of the pelvis, in the deep pelvis. So smooth muscle tissue lined with the mucous membrane folded into the ridge, and behind pelvis symphysis, where the bladder it's fixed in the base of the pelvis. The structure of the urinary bladder. Here the bladder and the prostate in the male, and then the urethra, and section here, sagittal section in the pelvis. We see the urinary bladder receive urine from the ureter and store the urine in the bladder, excreted through the urethra. Involuntary muscle action causes and voluntary muscle control external sphincter. store urine about 250 mils to 500 mils. Involuntary muscle action, bladder to contract and internal sphincter to relax. Urethra, tubules, canal lined with the mucous membrane, like in the female and in the male. It's varied from the length between the and the around area. Carries the urine from the bladder to outside of the body, and the external opening is called urinary meatus. Releasing urine from the body is called micturition, voiding urination, or in the informal language, it's called pees, like to pee or pees. Tubular canal lined with the mucous membrane, and in the about 3 to 4 centimeters long in the female, and like 20 to 25 centimeters in the male. The male urethra extended from the urinary bladder or the bladder neck in the floor of the pelvis through the penis to the urinary meatus, and like 8-inch longitudinal. And here the shorter female urethra extended from the bladder neck to the floor of the pelvis, just front of the vaginal opening. Urine color, it's like normally straw colored to clear. It's the normal color of the urine. Consists of 95% of water, and contain excess water, excess electrolytes, toxins, nitrogen wastes. And the normal 24-hour output about 1 liter to 2 liter. Its acidic and specific gravity vary from 1.001 to 1.030. Normal values for urinalysis testing, like color, straw colored or pale yellow to deep gold. Odor, aromatic, appearance clear, and specific gravity, as we mentioned, pH 5 to 8. Protein negative to trace, glucose none, ketones none, blood negative. Abnormal urinalysis finding elements about color. Color vary depending on the patient, fluid intake and output, or medication. Brown or black urine color indicate as serious disease process, or like red color as hematuria or some drugs, or etc. Odor, fetid or foul odor may indicate the infection, while fruity odor may be found in diabetes mellitus and dehydration or starvation. Other odors may be due to medication or foods. Appearance, cloudiness may mean that infection is present. And specific gravity, concentrated urine has a higher specific gravity. Diluted urine, such as can be found with diabetes insipidus, acute tubular necrosis, or salt-restricted diets, as a lower specific gravity. pH value below 7, acidic, is common in urinary tract infection, metabolic or respiratory acidosis. Diets high in fruits or vegetables, or administration of some drugs. pH higher than 7, basic or alkaline, is common in metabolic or respiratory alkalosis, fever, high protein diets, and taking ascorbic acid. Protein may indicate glomerulonephritis or preeclampsia in pregnant woman or nephrosis. Glucose, small amount of glucose may be present as a result of eating in high carbohydrate meals or stress or pregnancy and taking some medication such as aspirin or corticosteroid. Higher level may indicate poorly controlled diabetes, Cushing syndrome or infection. Ketones, presence of ketones may indicate a poorly controlled diabetes or dehydration, starvation, or ingestion of large amount of aspirin. Blood may indicate glomerulonephritis, cancer of urinary tract, some type of anemia, type of some medication such as blood thinner, arsenic poisoning, reaction of transfusion, trauma, burns, and convulsions. Adjective forms of anatomical terms: cystic, cysto, or cystic. Pertaining to the bladder, like cystoscopy or cystic cystitis, or like that. Glomerular, glomerulo, or glomerulonephritis, pertaining to the glomerulus. Meatotomy, like meatal, homatitis. Bilytic, urethra, or byelonephrostomy, pertaining to renal pelvis. Adjective forms of the anatomical terms: renal, renal artery, renal vein, like that, renal capsule. Urethral, uretroscopy, pertaining to the ureter. Adjective forms of anatomical terms: urethral, urethroplasty, pertaining to the urethra. Urinary system, or urinary bladder. It's the end of the adjective forms of anatomical terms. We mentioned like maybe very fast, but it's very clear that the terms here, renal or nephro or urethro or urethro or urine, like the main adjective forms of anatomical terms related to the urinary system. And we in the next week, like Wednesday, inshallah, we talk about the next section of this presentation about genitourinary system. Thank you very much. If there are any questions.